And the fact that humans can influence their own health and well-being using conscious breathing is so amazing to me. And you're literally able to reset your nervous system, regulate inflammation in the body, and even determine the quality of your thoughts.
Hi to all of our subscribers. I have a pleasure today to welcome a very special guest. Her name is Deepti Agarwal, and she's an anesthesiologist, Northwestern Hospital System. And Deepti is passionate about breathing exercises. So Deepti, welcome to our program.
Dmitri, thank you for having me.
So the first question is, what makes you so passionate about breathing exercises?
Well, if we take a step back for a minute and think about how breathing is such a fundamental part of who we are. It's the first thing we do when we're born, and it's the last thing we do before we leave this world. And as a practicing anesthesiologist on a day-to-day basis, we see how mechanically manipulating the breath controls various aspects of our body, how our heart pumps, how our blood vessels dilate and constrict, and how even the pH of our body changes. And the fact that humans can influence their own health and well-being using conscious breathing is so amazing to me. And you're literally able to reset your nervous system, regulate inflammation in the body, and even determine the quality of your thoughts.
Wow, very impressive. Okay, a lot of listeners of our channel are interested in how they could use breathing exercises to lower anxiety. So what
Yes.
would be your suggestion?
So it's, I think, important to remember first that by regulating our breath consciously, not only do we influence how we're responding to the outside world, but we also influence how our internal physiology is changing. And so in terms of stress, our nervous system it's bounced back and forth all day. And we basically are on this autopilot responding to different stimuli in our environment. And many of us have this chronically overactive fight or flight response and an underactive rest and relax response. So over time, this repeated firing causes an abnormality in our organs that release stress hormones. And so that abnormality eventually disrupts the balance in our body and leads to this cascade of events like increased blood sugar, increased inflammation, which gives us those lifestyle diseases like obesity, diabetes, autoimmune issues, anxiety. So breathing serves as this portal through which we can correct those imbalances that we've created for ourselves. And it helps our body purge all of that physical and emotional debris. So in terms of the breathing techniques, the slow, deep breathing, the ones with the long breath retention, are thought to help stimulate the vagus nerve and decrease the overall metabolic rate in the body. And this is what produces that physiological response that can decrease anxiety for people.
Okay, so can you give an example of breathing interval in terms of breathe in and breathe out, which would help to lower anxiety?
So I think that the most basic one for someone that's starting out is to think of the box breathing technique, which really works in intervals of 4. So inhale for 4 seconds, retain your breath for 4 seconds, exhale for 4, retain for 4. And if you can follow that pattern and get good at it, you can start manipulating the times to be longer.
If there a way to control high blood pressure with breathing?
So there are a lot of studies that are done on breathing techniques that conclude that consciously controlling our breathing puts us into this parasympathetic state. And in turn, it's going to lower a lot of those cardiovascular or heart parameters that we're looking for. So it decreases the heart rate, it decreases the blood pressure. And what I think is really interesting, and this isn't fully studied yet, but they've showed that if you mix breathing techniques with some physical postures, especially yoga postures, there's a link between the non-pharmacological technique and what statin therapy does for people. So that's already a direct link between the cardiovascular system and breathing exercises. And basically, it shows that it lowers the non-pharmacologic therapy, lowers atherosclerosis or plaque production. It produces nitric oxide, which is good for our blood vessels, and it decreases the inflammatory cascade that leads to issues like high cholesterol and blood pressure.
Mm-hmm. So I think you mentioned yoga, and we'll definitely come back to yoga in a minute because I know that this is also a topic which you're very interested in. But let me just ask, go one level deeper on the topic of lower blood pressure. Uh,
Mhm.
if someone who just starting to use breathing exercises, would they benefit also to start from the same box breathing method, which you recommended for anxiety, or they should try a different sequence?
Absolutely. I think starting somewhere is the best thing that someone can do. And there's a lot of, a lot of people talk about breathing techniques or pranayama, which is another
Mm-hmm.
form of breathing. But start somewhere, and box breathing, I think, is the simplest way to just get access to your breath.
Okay. All right. Got it. Thanks. And as long as you mentioned yoga, and you mentioned that there are some efficient postures or yoga postures which may be used to lower anxiety and blood pressure. So how can you explain the link between breathing and yoga poses, and how does it work together?
Yeah, so this actually, I think, is very important to understand because it's a source of confusion. So the practice of yoga is basically an art and a science for overall health. It unifies the mind and the body, and it's practiced in physical postures, which some people know as asanas,
Mm-hmm.
controlled breathing, which is what we're discussing, and concentration techniques, which is what people know as meditation. So the breath is actually the link between these three components. And that's what brings us to the present moment. And the breath helps us do these poses, and then it leads us into a state for meditation. And for the purposes of trying to understand these ancient practices in the Western world, we often separate the physiology, the anatomy, the psychology. But in reality, it's all very densely interconnected, which is why these practices have such a profound impact on our health. For people not knowing what their physical abilities are,
Uh-huh.
starting with breathing is probably the best thing. And that is actually a version of yoga.
Uh-huh.
And then people would need a little bit more hands-on detailed training just based on their body type, what their medical conditions are.
Okay.
But breathing is probably the number one easiest thing that someone can do while sitting that
Okay.
can help their blood pressure.
A lot of our subscribers observed that a bad night's sleep often results in irritation and then higher blood pressure. Would you recommend any specific breathing exercises which would prepare us for a better and restful night's sleep?
Right. So bad sleep has a whole cascade of events, and I think it's a very underrated part of our lifestyle. Even just a small amount of bad sleep sets off this whole inflammatory cascade in our body. And it's pretty amazing how it can do that so fast. I don't think that there's necessarily a prescription for this. I always emphasize that these things become a lifestyle issue, and everyone needs to find strategies to make every day restorative for themselves. So we need to find some sort of balance. So, and I feel like a broken record, I'll probably say this multiple times, but even starting a daily practice of 5 minutes a day and being able to engage on that is helpful. And you want to find breathing techniques that will engage your parasympathetic system so that you can have that rest and relaxed state before you go to sleep.
Okay. All right. Got it. Thanks. Now switching gears, and because before we talked about calming effects of breathing exercises, but also I get a lot of question about breathing exercises which boost energy. So can you explain the difference between the two, and how do we emphasize breathing exercises which energize us?
Sure. So in terms of breathing techniques, we've talked a little bit about the slow, deep breathing.
Mm-hmm.
Those generally have a longer breath retention. And as I mentioned, they stimulate the vagus nerve, They decrease the oxygen consumption in the body, bring our metabolic rate down, and they give us that effective deep relaxation. The activating breathing techniques do exactly opposite. They stimulate our sympathetic system. So they increase the body temperature, they increase the heart rate, they help energize or give you a boost of energy. And there's two breathing techniques that generally fall under this category. And one is called bellow breathing. If someone was interested, they can look that up. And the other is a skull cleansing breath. So those are the two main breaths that do that. That type of breath I wouldn't recommend before you're going to sleep. That type of breath I would recommend in the morning before you're starting your day or before you're engaging in some sort of physical exercise or a workout.
Is effectiveness of Wim Hof method, which has become quite popular over the last few years. So what's your take? And again, how is it different from the two methods which we discussed so far?
Right. So Wim Hof just came out with a book, so his method is definitely gaining popularity. But the Wim Hof method, basically, it's a fairly aggressive breathing technique. So it's breathing plus immersion in ice baths, or what we refer to as cold therapy. And it's fairly progressive with the types of studies that they've conducted. The point of this technique is to put your body in a state of hormesis, which basically means giving your body some sort of stressor that is beneficial. So the idea is comparable to physical exercise, where you stress your body to become stronger, but not necessarily harm it. So what do we know about the Wim Hof method? So the method, it's proven to activate our innate sympathetic response. So what we talked about with the fast breathing techniques. And this has been found to decrease inflammation in our body. So it's helpful actually in improving our immunity naturally, and also helps us with conditions like autoimmune diseases, which have a lot of inflammatory factors released in our body. And the other idea that I find interesting behind Wim Hof is, and this is any sort of fast pranayama breathing technique, is that the voluntary stress that you're producing in your body by breathing fast actually theoretically leads to more resilience in handling everyday life. And it gives you a sense of control. So you feel more in control of your daily life. So it's good for the mind, good for the body. I think if there's one message I can impart today, I would love for everyone to understand that small steps that you have control over can have lifelong impacts on your overall health. And there's no literature review, there's no controlled trial that will do justice over you just experiencing it yourself. And I'm sure, Dmitri, you've had the same experience, but there's subtle micro changes that occur in your body that everyone has to appreciate for themselves.
Yeah, my experience, which my recent experience is that deep breathing, among other things, helped me to increase my cycling VO2 max number, because I was I reached a plateau I stayed at this plateau for about 6 months. But after practicing some deep breathing for just about 2 months, I bring it up by another 5%. And it's just my personal experience from using breathing exercises outside of treating chronic conditions.
Right. And as you increase that breath retention, you actually are able to increase slowly your lung capacity over time, which is what's probably helping you with your cycling.
Okay. All right. Deepti, last question. If someone wants to reach out and read about you or ask any questions, so what is the best way to get in touch?
So the best way to get in touch is via my Instagram page at Breath and Body MD. And if someone has any questions, I'm happy to answer them.
Got it. Deepti, thanks a lot for your time and for exciting discussion. I really appreciate.
Thank you.